About 50% of the world population, that is approximately 3 billion people, live below the poverty line of $2.50 per day, and many people are deprived of even the basic necessities of life, like healthcare, shelter, and nutrition. Under such dismal circumstances, the goal of achieving a targeted standard of life for the whole world seems delusional. With the support of medical bridges and healthcare organizations from USA, Helping Hand for Relief and Development continues to assist the natural or otherwise calamity-stricken communities in the different parts of Pakistan through in-kind gifts program. Where all seems bleak and no ray of hope is to be seen, there are certain peoples that try to uplift the situation. Medical Bridges is one of them. HHRD and Medical Bridges work in different ways and help the needy through in-kind gifts program. Through this program, Medical Bridges share their feelings and experience the satisfaction of helping their brothers and sisters in despair by sending items to the most deserving communities of Pakistan.
This is a tertiary care hospital which caters to the needs of persons with disabilities, and as we all know that disability and poverty are closely linked together. So most of our patients are very poor and they need financial assistance and they need free health care, which we are here to provide. We are very thankful to Messrs. Medical Bridges who have donated this container full of very useful goods. They include especially surgical disposables which have been used in our operation theatre for the care of people who don't have much to spend on healthcare. And then we also have received very good physiotherapy equipment as well as some very useful phlebotomy chairs, which are especially useful for children with disabilities who have a problem of positioning, and then it's very easy for them to sit in those chairs and for our phlebotomists to drive blood samples from them.
Assalamu alaikum. I am Dr.Saba Yousaf, representing the Gynae Ops Department of Banazir Bhuto Hospital. I am here to pay my due regards to the Medical Bridges who has provided us a number of beds and delivery couches and number of medical facilities which is surely and positively supporting our patients. We are very grateful for all these medical facilities that is helping the patients in the representing in the BBH hospital. We want the Medical Bridges to provide us more medical facilities, more beds, more delivery couches so that it can facilitate all the patients who come into BBH and so that we can serve them properly. Thank you very much.
In-kind gifts program of HHRD and Medical Bridges aims to provide relief to disaster-affected people and to explore the avenues of support for health, education and development of health infrastructures for an improved health system. The major interventions include medical supplies and equipment to non-profit hospitals of Pakistan, including medical equipment, supplies, physiotherapeutic equipment, ICU beds, hospital beds, dialysis machines, ultrasound machines, cabinets, consumables, and lot more worth millions of US dollars to improve the health infrastructure.
As you see that we have donated this medical equipment and supplies in conjunction with the Medical Bridges, who is the donor in America and has donated the equipment and supplies to your hospital. How do you think that this equipment and supplies are going to assist the community in the long run?
Actually, being in charge of this medical ICU, we are dealing with critically ill patients who needs care in different positions. Someone we have to treat them in upright position, some in propped up position, and I am very thankful to Medical Bridges who have donated us these electronic beds, which helped us a lot in the management of these patients. And previously we are having manual beds which were very difficult to manage in these type of patients, and these beds are working very efficiently and they are helping very much in the management of the patients.
HHRD and Medical Bridges assure that these donations reach the most deserving and benefit maximum people. For this purpose, the support is given to hospitals offering free medical care to the poor segment of the society.
I am Dr. Asif Qadir Mir and I have been posted as Medical Superintendent in Banazir Bhuto Hospital. I have been working here in collaboration with Helping Hands which has very generously contributed in the shape of kind equipment, electromedical equipment such as anesthesia machine, ultrasonography machine, hospital furniture including electrically operated patients' beds, beds for the ICU, disposables in a large quantity, and we are very much thankful to them for this generosity, which will go a long way in the benefit of the patients. I am thankful to all the team of Helping Hand and the donors, Medical Bridges, for their kind and generous cooperation in this regard.
Along with these efficiency control methods, HHRD also maintains strict account of all the shipments donated by Medical Bridges and ensures maximum benefit for the deserving people through an organized and well-checked mechanism. In recent past, 12 containers of medical equipment have been distributed in various areas of Pakistan.
I am Dr. Tariq Masood, Niazi, officiating Medical Superintendent, Holy Family Hospital. We are thankful to administration of Medical Bridges and Helping Hand. They supported us. Actually, although government tries to provide all types of instruments to hospital, but sometimes there is constraints of budget and we have limited resources. So we invite the NGOs and these people to come forward and help us. When we contacted the officials of Medical Bridges and Helping Hand, they helped, they provided surgical beds and surgical OT tables to us and a large number of consumables, which these beds are present in medical ICU, surgical ICU and gynae operation theatre and gynae emergency, and all these consumables are being used by the patients, and hundreds of the patients are benefited from these beds and from these consumables. We are thankful to Medical Bridges. Thank you very much.
HHRD, in conjunction with Medical Bridges, assures that its resources are not ill-managed and they achieve the desired purpose of betterment of the destitute, especially in terms of health care.
I, Dr. Tabinda Zaman, Chief Medical Officer and Chief Executive Officer of the Social Security Hospital, Islamabad, is very thankful to Helping Hand and Medical Bridges for medical supplies, consumables and equipment they have donated us. But we want to continue this partnership in future so that all the emergent needs can be addressed through these partnerships. Thank you very much.